Hi, this is Dr. Tom McFadden of Advanced Cosmetic Surgery. We're here in Greenville, South Carolina. We do the full gamut of surgical and non-surgical cosmetic procedures here. And let's see what video topic we're going to cover today.
Hey everybody, this is Peter Felice at Advanced Cosmetic Surgery, and this little video is going to talk about what to expect with respect to tummy tuck surgery. So a lot of patients want to know, what is the process like before, during, and after with the recovery for the tummy tuck? And I tell them that there's a couple things that we want to look at in terms of expectations. Number one comes from, what's the procedure that we're going to do? A tummy tuck or abdominal contouring can consist of lots of different procedures or combinations of different procedures, mainly liposuction, possibly mini abdominoplasty, and also there's the full abdominoplasty. Liposuction is a great option for patients that might just have a little bit of tissue underneath the skin, might be a little bit stubborn fat that doesn't want to go away with diet or exercise no matter how hard you try. And liposuction is a really good way to remove some of that fat, leaving behind the skin just to get a little bit more contour and a little bit more firm shape of the abdomen itself. When we're talking about a mini tummy tuck surgery, it's a little bit more than just liposuction. We do liposuction, but we're also removing the skin and the fat below the belly button just to try to help with that really stubborn, poochy area of the lower abdomen between the pubic bone and between the belly button. When we're talking about a full abdominoplasty, it's a little bit more involved in terms of the procedures that we do. Number one, liposuction is always included. Number two, we do a procedure that's called rectus plication. We're actually taking the six-pack muscles at the front of the abdomen and securing them back in place in the middle of the abdomen to give you a nice, tight internal corset and a great shape to your abdominal wall. And then we're also removing extra skin and fat towards the bottom of the abdomen. With the full abdominoplasty, we also give a new belly button opening where the belly button comes through on that new reshaped abdominal wall. And all of these procedures are done here in our fully accredited surgical suite right here at Advanced Cosmetic Surgery. So during the preoperative appointment, you're going to meet with a surgeon, you're going to meet with the patient coordinator, and the idea is I want to do a full history and physical exam and see what some of your concerns are, but also hear what some of your concerns and expectations are. During that appointment, I'm going to be looking at the quality of the skin, I'm going to be looking at the soft tissue underneath the skin, and also listening to what the concerns are and what the patient's goals are to try to find out which is going to be the best procedure for them in terms of what the goal is and the expectation of the result and the best way to get there. Is it liposuction? Is it mini abdominoplasty? Is it full abdominoplasty? And really trying to figure out the best way to achieve a goal based on what the patient's after. So during the preoperative appointment, we're going to give you written instructions and also verbal instructions in terms of what to expect for portions of the recovery after your tummy tuck surgery. We'll go all over the prescription medications that you'll receive afterwards, and we'll also go over some of the expectations in terms of physical activity, any activity limitations, and kind of give you an idea of what to watch out for as you continue through the process of recovery after your operation. So on the day of the surgery, you'll come to our preoperative area that's right here in the building at Advanced Cosmetic Surgery. You and I will again have a conversation to review the operation, any changes in your history and physical, and again we're going to talk about your goals and the expectations for the results of the procedure. At this point, I'll take your before photos and I'll also do some drawing so you'll see exactly where the planned incisions and areas of liposuction are. Normally for the abdominoplasty, the incision goes from hip to hip, low underneath the underwear line, and we place that incision low to try to keep it as hidden and discreet as possible so it's not seen in clothing, bathing suits, things like that. You'll meet the rest of the operating staff, you'll meet the rest of the anesthesia staff, and we'll get you ready to go for the operation. Once we get started and once we finish, it'll seem like time goes by as if you're just falling asleep and waking up for a nap. It'll be over like that. You'll wake up in our preoperative recovery area, and at that point you'll have a compression garment on that's going to keep your body nice and firm and compressed, and to make sure that we have a little extra padding and a little extra protection for all of the areas that we've operated on. So after abdominoplasty procedure, most patients stay in a recovery room suite for about 45 to 60 minutes, just making sure everything is comfortable, there isn't too much discomfort from the operation, and that you're up and walking around and starting to have a little something to eat or drink without any complications. After that, patients go home with a loved one who can stay with them overnight, and then we'll see you back at the office the next day to make sure that you're looking and feeling great. So I tell most patients to expect a decent level of discomfort after the operation. The reason being is when I do the rectus plication portion of the procedure where we're sewing the abdominal musculature back together, that can cause a lot of soreness for patients in the post-operative period. Many of them do great with non-narcotic anti-inflammatory medications and also in combination with nerve blocks that we do before and after and during the operation. But all of this is expected to gradually get better day by day. Usually around 5 to 7 days after the procedure, patients find there's very little discomfort. They're up and active and doing a lot of their normal day-to-day activities without any limitations and really starting to turn the corner and take off with the recovery for the procedure. Patients are going to have their first follow-up appointment the day after their abdominoplasty surgery. And this is just to check up on the scars and see how patients are feeling, make sure there isn't anything out of the ordinary in terms of the recovery process. After that, we normally see patients every week for the first month, and then we'll see patients 2 months and 3 months after the surgery and take photographs along the way to make sure that they're progressing well. So in terms of activity, lifting limitations, things like that after abdominoplasty surgery, I tell my patients no lifting anything heavier than about 15 pounds for the first 2 weeks. The other activity that's very important for them to be doing is be up and walking every hour. It's good to get the circulation going and the blood flowing just to make sure that people are up and moving around and to minimize the risk of any type of problem such as blood clots after this operation. I tell patients that they can resume full cardiovascular activity about 3 to 4 weeks after the operation. I don't want them doing any type of yoga or running or cardiovascular activity or anything like that until we've got a good sense that the incision is healed well and all of the musculature is feeling good and appropriate before they start doing their normal activities. But by then, usually about a month after surgery, I have no limitations for my patients and they can do any type of activity so long as they can comfortably tolerate it. Thanks so much for watching this tummy tuck video. Any questions or comments, please make sure to post them below. And also make sure to hit the like button and subscribe so you can see more content like this for all of our surgical questions and videos. Thanks so much.